Bismillahirrahmanirrahim. In today's lecture, we will discuss about the significance of pKa in pharmacokinetics. So pKa is always for the drug. जिस तरह हमने discuss किया है कि it is always associated with the drug molecule, and pH is always associated with the solution. It is associated with the medium. तो pH जो है ये मीडियम के साथ एसोसिएटेड है और pKa वैल्यू इज अगेन इट इज एसोसिएटेड with the drug, and this is the pKa value as well as the pH of the medium that basically determine that how much the drug will be ionized and how much drug will be in unionized and ionized form. तो जो unionized form of drug होती है that is basically absorbed. So we will look into the effect of pKa value in different pharmacokinetic parameters such as the absorption, distribution, metabolism, and the elimination. So let's begin with the first slide. So this slide is basically about the pKa value role in different ADME. ADME simply means the absorption, distribution, metabolism, and the elimination or the excretion में क्या क्या इसका role है. So moving to the next slide, that is about the significance of the pKa in drug absorption. So we know that it is the unionized form of the drug that is basically absorbed. So the ionized form of drug is water soluble, that's why it cannot be absorbed. So if the drug is given by any extravascular route, whether it is intramuscular route, whether it is intraperitoneal route, whether it is oral route, or any other extravascular route, there is a process of absorption and the unionized form of drug, because that is non-polar lipid soluble, crosses the biological membrane. तो उसको वो biological membrane को unionized form drug की cross करती है. So that's why the pKa value helps us to determine कि drug की absorption कैसे होगी, because the pKa is again associated with the drug. और pH जो है हमारे different जो mediums हैं, I mean the different organs हैं, उनकी pH जो है फिक्स है और ये pKa वैल्यू ड्रग की फिक्स होती है. सो बोथ दीज फैक्टर दे बेसिकली डिटरमिन के वो ड्रग की जो रेशियो है, आई मीन द आयोनाइज्ड और अनआयोनाइज्ड फॉर्म वो कैसे एग्जिस्ट करेगी. सो इट इज़ द अनआयोनाइज्ड फॉर्म ऑफ ड्रग दैट क्रॉसेस द बायोलॉजिकल मेम्ब्रेन, एंड pKa वैल्यू इज़ हेल्पफुल टू डिटरमिन कि ड्रग की अब्जॉर्प्शन होगी या नहीं होगी, बिकॉज द pH और pKa का आपस में रिलेशनशिप एग्जिस्ट करता है. फॉर most of our drugs, जो जितनी भी हमारी drugs हैं, they are either weak acid or they are weak bases. So if the drug is weak acid and it is given by extravascular route such as the aspirin, it has to be absorbed from the stomach because it will be in unionized form inside the stomach. But because of less surface area, the drug aspirin, it is mostly absorbed in the intestine, otherwise it has to be absorbed from the stomach. तो intestine में although drug is आयोनाइज, लेकिन वो जो बैलेंस होता है, जो इक्विलिब्रियम होता है, वो शिफ्ट होता रहता है. दैट्स वाई प्रैक्टिकली द एस्पिरिन इज एब्जॉर्ब फ्रॉम द इंटेस्टाइन एंड थियोरेटिकली द ड्रग हैज़ टू बी एब्जॉर्ब फ्रॉम द स्टमक, बिकॉज द स्टमक का जो मीडियम है इट इज़ एसिडिक इन नेचर, और वीक एसिडिक ड्रग सच एज द एस्पिरिन इट इज़ प्रेजेंट इन अनआयोनाइज्ड फॉर्म. So the next is about the weak basic drugs. We have lot of drugs such as the tricyclic antidepressant. They are basically weak basic drugs, very good example, and they have to be absorbed from the intestine, and intestine has got lot surface area, number one, and these drugs, they are basic in nature. They are therefore in the intestine they are present in unionized form. In the stomach they should be present in ionized form. तो ये जो वाटर soluble form है, that is the ionized form, it is not absorbed from the stomach, but it is these drugs, I mean the basic drugs, they are absorbed from the intestine. So taken together, the acidic drugs, they are absorbed from the stomach, basic drugs, they are absorbed from the intestine, but unfortunately the stomach has got very less surface area. That's why although the acidic drugs need to be absorbed from the intestine, they from the stomach, they are basically absorbed from the intestine because of the large surface area due to villi and macrovilli of the intestine, especially the small intestine. Okay, moving to the next slide. Here you can see that when any drug that it is given by extravascular route, whatever is the route, suppose we are taking the solid dosage form, it goes into the GIT, there is disintegration process, and then there is dissolution. After dissolution, drug become available in the form of solution, and once it is in the solution, it is the unionized form of drug that is basically absorbed, and it moves from the GIT into the enterocyte, which means the cells of the cells of the small intestine, and it is the unbound form of drug that is basically, again, it is available and it is readily to be distributed into the blood, and then it goes into the liver for first pass effect. So basically the basic concept is कि जो drugs होती हैं, this is the unionized form of drug that is basically absorbed, and ionized form of drug, it is available in the in the form of ions. That's why it cannot be absorbed. So unionized form of drug, it is mostly absorbed in the GIT. So moving to the next slide, that is about the significance of the pKa in drug distribution. So the drug distribution, we have for the distribution, drug has to go into the cell, into the tissues, into the brain. So if the drug has to cross the blood-brain barrier, that is you can say the barrier between the brain cells and the blood, that is called as blood-brain barrier. इसका concept जो है that will be coming in the other lectures, but very simply, blood-brain barrier is composed of the tight junction between endothelial cells, and then there is wrapping of the astrocyte that form the blood-brain barrier. So the drug has to cross the blood-brain barrier, and it is the unionized form of drug that crosses the blood-brain barrier. And for the cells inside the cell, drug has to cross, and again it is the unionized form of the drug that crosses the membrane. Once inside the cells, if the pH of the cell is different from that of extracellular fluids, then in that situation there could be the trapping of the drug in that fluid, और वो सेल के फ्लूइड के अंदर इसकी ट्रैपिंग हो जाती है, because drug become ionized in that cell. That's why once trapping occurs, drug will be accumulated in that cell. And very best example in our case is the chloroquine, and chloroquine is the basic drug. Its site of action is RBCs, because malarial parasite exists in the parasite, and it is the basic drug. Once it is present inside the RBC, the drug become ionized, because drug is basic in nature, and the medium of the RBC is acidic as compared to the extracellular fluid or from the plasma. प्लाज्मा की जो pH है that is 7.4, और जो I mean the erythrocyte RBCs की जो pH है that is a little bit acidic in nature. So that's why chloroquine, it become ionized in the RBCs, and that's why it become trapped in the RBCs, और it produces its effects. ये अपने वहाँ पे effects produce करती है, and this ion trapping is very helpful in cancer treatment, and chloroquine is another example that is used as anti-malarial drug. So next is the significance of pKa in drug solubility, and again it is the ionized form of drug that become more water soluble. The unionized form is lipid soluble, and this is the pKa value that maintains the balance between the solubility and the permeability. So the solubility is associated with the ionized form of the drug, and permeability is associated with the unionized form of drug, because the unionized form is lipid soluble. It does not carry any charge, so it crosses the membrane and it goes into the blood. So moving to the next slide, that is the significance of pKa in excretion, and it is the basically urinary pH that is the acidic in nature. So alkaline drugs, जो हमारी जितनी भी alkaline drugs है, in the acidic medium, they will become ionized, and they will be eliminated from the urine. तो जो हमारा यूरिन है, it is acidic in nature. जब हम basic drugs देते हैं, they become ionized and they are excreted from the urine. So alkaline urine increase the excretion of weak acid drug. अगर हम किसी तरीके से यूरिन को अल्कलाइन करते हैं, the weak acidic drug they become excreted from the urine. So because the urine has become the basic, इसकी pH को increase किया गया है. If the urine is acidic, it will increase the excretion of weak basic drug, because the weak basic drug they will become ionized and they can not be reabsorbed from the nephron. तो इसलिए हम कहते हैं कि urinary pH is very important to determine whether the drug will be excreted or not. And if the drug is present in the ionized form, it will be excreted. If the drug is present in the non-ionized form, it will be again reabsorbed and it will be going back into the blood. That's why this philosophy of changing the pH of the urine is helpful to counter the toxicity of many drugs. And the best example is barbiturates. Barbiturates are basically acidic in nature. हमारे जो barbiturates हैं, they are acidic in nature, and these barbiturates, if they are taken in large amount, the urine, it is made basic by using the sodium bicarbonate, and then the barbiturates, they are basically excreted out from the urine to prevent the toxicity. Therefore sodium bicarbonate it is used. ये barbiturates acidic drugs है, उनकी pKa value जो है according to it is less, so that's why they are basically eliminated from the urine if the urine is basic by means of sodium bicarbonate. Okay, so moving to the next slide, that is significance of pKa in drug formulation, and it is very helpful in designing the oral dosage form, controlled release dosage form, and it ensure the proper बायोअवेलेबिलिटी ऑफ द ड्रग. इसलिए इसका बहुत बड़ा रोल है पीएच का, आई मीन के पीकेए एंड द पीएच का. So that's why they are helpful to ensure the proper bioavailability. That simply means the rate and extent of drug that is available at the site of action. So the rate of action that reaches the systemic circulation and is available at the site of action, that is called as the bioavailability. So that's why the pH and the pKa, they are very helpful to determine the bioavailability of the drug, because it is the unionized form of the drug that crosses the membrane. So taken together, the what is the significance of pH and the pK on drug ADME? I mean the absorption, distribution, metabolism, and the excretion. Absorption, it affects the solubility, solubilization, dissolution rate, disintegration, free concentration in the GIT, passive permeability, active uptake, efflux, and intestinal macroflora. So all these things, they are affected by means of pH and the pKa value. They affect the enzyme activity, they affect the enzyme mediated drug interaction. So pKa also affect the blood or plasma partition, blood protein binding के unionized form bind होती है या ionized form bind होती है, and binding to the acid, phospholipids and trapping within the intracellular organism. जिस तरह मैंने आपको example दी है with the RBCs, active transporter mediated drug interaction, and it is helpful to look into the toxicity because it is the unionized form that become accumulated inside the cell, and it can causes the toxicity. So bioaccumulation means the toxicity में भी इसका role है. Excretion में it is the unionized form of drug that is excreted in the urine. So that's why we can say that this is the pH and the pK crosstalk is very important to determine the absorption, distribution, metabolism, excretion, and again the toxicity. So with this, I will conclude today's lecture. If you have any question or you have any query or any confusion, please mention in the comment section. Thank you.